Dr. Goldstein, can you define prematurity and tell us how common it is nationwide?
Sure. Prematurity is defined by a baby being born at less than 37 weeks completed gestational age. Nationally, prematurity affects approximately 1 in 8 pregnancies. It's interesting in that most women really don't have an idea of what prematurity is all about. When you ask moms, they say that 9 months is term. Well, in fact, when you translate it out, 9 months is 36 completed weeks. So the essence of it is that babies that are born after 9 months are in fact born prematurely.
Wow, okay. Well, are there any states at a higher risk than others?
Well, there are certain states that have prematurity rates that approach 14%. The national average, however, is 1 in 8, which translates to about 12.5%. So there's considerable variation from state to state. Some that do very well and others that do maybe not so well for a variety of different reasons.
What, such as?
Well, a lot of it pertains to disparity and issues of access to care, issues that affect, I guess you could say, the kind of care that's available. You know, whether there are providers, for example, in that state that can provide the premature care, and certainly the socioeconomic status of the family is critically important, oftentimes in the delivery of the care. These are all things that we're working as a nation to do better on.
Got it, got it. Kristen, as a mother of preemie twins, you know about preemie special health needs firsthand. Can you tell us a bit about your daughter's experience as well as yours?
Certainly. My daughters were born at 30 weeks, which is 10 weeks premature, and they were in the NICU for 5 weeks, and they were only on oxygen for 2 days, and they actually did quite well in the NICU. We got them home, and they thrived in terms of growing quickly and gaining weight and meeting their initial milestones. However, because they were looking so great on the outside, we were led to believe by the pediatricians that we should treat them like full-term children. And unfortunately, they caught RSV, which is a common cold for an older child or an adult, but it's very, very devastating for a preemie to catch that, especially in their first year of life. So since then, they have suffered from chronic lung illnesses and chronic lung inflammation, which basically means when they catch a cold, it is very hard to get rid of it, and they have to be on nebulizers and inhalers and other medications to help them through it. And what we learned the hard way was that preemie lungs are very fragile those first several years.
Wow, okay. How old are they now?
They're almost 5. And
they're still dealing with this?
Yeah, they're still dealing with it. So it's been several years, and it's looking like it's not going away. We even had their tonsils removed in hopes that that would reduce the illnesses, but it has not.
Wow. Dr. Goldstein, what should parents know when they have a premature baby, and can you tell us a little bit more about RSV?
Well, in the context of RSV, it's very important that parents understand that a lot of RSV can be protected. RSV is a type of virus that affects preterm babies and can result in devastating consequences, especially when that baby is born, I guess you could say, before the corrected 37 weeks gestation. Oftentimes these babies will need to be admitted into the hospital, and as Kristen was saying, they can be affected, these babies, for not even months but years after coming down with RSV. The things that we tell parents in terms of avoiding RSV are the simple common sense things. Essentially, make sure that the home is clean, wipe down surfaces, try to keep your baby away from places like crowded malls, shopping centers, where respiratory viruses are, for that matter, and learn to say no. Tell your friends, tell your family that they can't visit if they have the sniffles or are just getting over a cold. These are things that put babies at risk.
What would you say would be the difference between your preemie getting a cold and starting the symptoms of RSV?
Well, oftentimes they're one and the same. It's hard to tell which colds are going to progress to severe infection resulting in hospitalization. And that, for that matter, not all babies that have common colds, they're not necessarily tested by the pediatrician in the office to determine whether or not it's RSV. Now, not to say that RSV can't just be a simple thing in a baby that was born prematurely, but these babies are at increased risk for severe infection. And so, again, I guess in the early stages, it's very hard to tell the difference, and I would urge the parents, especially if they have a preemie, to make sure that even if the baby has what appears to be on the surface to be a little bit of cough, a little bit of congestion, get the baby into the pediatrician and have the baby looked at and checked out to make sure that it's not something that's more serious.
Okay, so premature baby, symptoms of a cold, go ahead and don't try and wait it out. Go ahead and just make that appointment.
Absolutely.
Definitely.
All right, Kristen, what advice would you give to parents of preemies who are bringing their new babies home on how to prevent RSV?
Right. I would definitely suggest not taking your kids to grocery stores and churches and other germy places, keeping your kids away from toddlers and school-age children who are just really covered in germs. And importantly, if you do go back to work, which I had to, if you can avoid going to a large daycare center, which RSV is much more prevalent, maybe an at-home smaller center or a nanny if you can afford it. That's what we ended up doing. We switched to a nanny once the RSV happened. So those are good ways to prevent it, and also just educate yourself. Get on the internet and research. It's hard to not feel like a regular parent those first few years when you see your friends going on play dates on the afternoon and you can't because you have to protect your child. I found a lot of other preemie parents through online preemie support groups, and that really helped me feel a lot less isolated, and it gave me a lot of good information to arm myself with.
Okay. Do you have any advice for people who might have, say, a toddler go to daycare?
And they have a preemie as well at home?
Yes.
The best thing you can do is to, when your toddler comes home, make sure he's, washes his hands and does all that good stuff to keep him, hopefully keep him healthy. If he does get sick, many people I know have tried to separate them physically in the home and do whatever you can to keep the toddler away from the baby. There are circumstances where it's very difficult to do that. I understand that. I'm sure the doctor has seen that as well. Maybe you could speak more to that as well.
Yeah, it's very difficult to keep a toddler away from a small baby because toddlers are curious and they're interested in knowing and they want to help their mommies and daddies take care of the new little baby. But oftentimes it is that effort in not only keeping the toddler clean, but yes, trying to keep the baby away. And I know in many cases it's impractical, but if you have friends or close relatives who can help out and potentially take the toddler during a period of time when the toddler may be sick or have an infection. And again, it's oftentimes asking the impossible, but
Right.
that can help prevent the baby from getting RSV.
And it is that important to try and separate instead of saying, oh, well, a little contact might be okay.
Yeah,
Definitely.
absolutely.
How long do parents of preemies need to be on guard? Is there a point in time when a preemie catches up and the risk is not as great?
Well, in fact, it's one of those things that you really have to be on your guard for, and especially if the baby has come home on oxygen or is a little bit sicker, it can go even into the second year. For more information, there are online resources like rsvprotection.com and also preemievoices.com that people can go to for additional information about the topic. Thank
Okay.
you.
Great. Thank you so much.
Thank you.
Kristen, is there any group, is there a website for moms, preemies that might help as well?
Yes, there's an organization that I belong to called handtohold.org that has a lot of great information for parents, as well as some online websites that you can go to that are preemie support websites. So I highly recommend that. Thank you very much.
Thank you so much.
Thank
Thank
you.
you both for your time.
You're very welcome. Thank
Thanks.
you.